recovering after suffering from a brain hemorrhage in the middle of a game.
He passed out in the dugout, surrounded by his teammates and doctors. Now, the incident has a lot of people wondering about aneurysms, and joining us to talk a little bit more about those and Stroke Awareness Month, which is in May, is SSM Health Dr. Mandira Mehra, our medical expert. Good morning. Good to see you.
Good morning. Great to see you.
So we're talking about just how scary this is, and in many ways, he was fortunate in that he was surrounded by all these people close to a hospital in an urban metropolis, but this raises all sorts of questions about strokes.
I mean, he was on the ground, he wasn't in air, he wasn't on the road, so yeah, lots of kind of silver lining points here. But a lot of people kind of have this common misunderstanding that, wait, a brain aneurysm or hemorrhage, that's a stroke? And so we're here to really talk about that stroke awareness, and there are two types of strokes. One is the classic, the plumbing in the brain gets clotted off, kind of like a heart attack, where the plumbing in the heart gets clotted off. The second type, like in this case, is where the blood vessel actually ruptures, and so you have a brain bleed. So the two types of stroke, and it can happen to any age. That's the first thing we want to raise awareness to. Obviously, this is a younger individual. You don't really think of stroke as something that you should be looking out for, but immediately symptoms can present, like in his case, as vomiting, nausea, severe headache, losing consciousness, that kind of thing. But it also is a disease, of course, that we think of in the older population. There are so many factors we can't control, and like we were talking about, Danica and Adam, things like how old we are, our age, maybe some of our genetic risk factors, but they say up to 80% of strokes are actually preventable. That means that we do have some control, maybe over those modifiable risk factors. And it has to do a lot with the risk factors we always talk about. So things like having that healthy diet, exercising, avoiding smoking, moderate alcohol consumption. And then, of course, if you have any pre-existing conditions like hypertension, hyperlipidemia, high cholesterol, really trying to mitigate those factors and do the best that you can. If you have additional factors like atrial fibrillation, of course, talking to your doctor about medications and what we can do. There's signs and symptoms we can look out for. We always talk about B FAST. So B-E-F-A-S-T. Nice acronym, kind of helps us remember the symptoms. So B would be balance. If someone starts losing their balance. E for eyes. Vision changes, all of a sudden can't see out of one eye, something like that. F for facial droop. So the classic symptom, maybe one side of the face all of a sudden looks uneven. And then we talk about A, S, and T. So A can stand for, of course, that age, or it can stand for other factors like that. And then S, if suddenly you have that slurred speech. T for time, call 911. Don't hesitate, don't sort of lie the patient down or family member down and start doing an exam. If you think it's a stroke, call 911, time is brain. There's intervention and there's some treatable things that we can do.
Absolutely. We wanted to ask you too about the study, have about a minute left, about concussions at any level and how they're now connected to some really serious issues later on in life.
Right. So we always talked about, for example, Muhammad Ali, you know, the great Muhammad Ali. Did he perhaps develop some Parkinson's or some brain issues because of all the traumatic brain injury? In this case, we're saying there is evidence that the more traumatic brain injuries we have, the more likely we are to then perhaps have other brain issues later. So Parkinson's is sort of one thing that we're looking at, but this is a great study that's showing us the more we can avoid brain injuries, maybe the better off we are in terms of preventing some of these causes later. Not at all to say that if you haven't suffered a brain injury, you'll never have Parkinson's, you'll never have Alzheimer's or any other disease process like that.
Or the other way around.
Or the other way around, exactly. And so this is not a headline to misinterpret, but it is telling us there may be some association. Perhaps the more brain injuries we have leads to a cascade of symptoms where the brain can't clear and heal and do its job like it should.
Also a very scary thing to think about. Yeah, absolutely. Dr. Mehra, thank you so much for joining us this morning.
Nice to see you.
Appreciate it.
News Today this morning. I'll be right back.